This is William Goff, and this is my Fragile X syndrome presentation and our genetic counseling appointment for Mrs. Walters. Brief description, inheritance, case recommendation, and further treatments and testing. Fragile X is a mutation of the FMR1 gene that leads to changes in brain development and is more prevalent in males, which I'll touch on further. It is far more prevalent in males, as you can see, from 1 in 7,000 in males to 1 in 11,000 in females. What we can take away from this is, Fragile X is autosomal dominant. It shows up in both homo and heterozygous genes that have the mutated FMR1 gene. It is present in both genders, males and females. However, males tend to experience worse symptoms, such as more exaggerated facial deformities and more difficulties learning and more further side effects resulting from the damage to nerves and improper forming of the brain. So fathers cannot pass the mutated FMR1 gene to their sons because they, when the egg is conceived, they only give their child a Y chromosome. However, mothers can give the mutated FMR1 gene to both daughters and sons because they, give an X chromosome. So here we have the pedigree. We can see that the father of Alton is clean. He's not a carrier because he would be showing symptoms of mutated FMR1. The mom is most likely the carrier. Well, not only that, but as you can see, his father only gives him a Y chromosome, not the mutated X chromosome. So it has to be the mom. And one of her other 3 sisters is likely a carrier because she received the gene from most likely her mother, and one of her other sisters most likely have it. I will also touch on that further. Here's the Punnett square for the Walters family. We can disregard this first one. We can disregard this row because they only have a son. We can see that it was a 50-50 chance of Alton having the mutated FMR1 gene, with this one being the not mutated chromosome, but this one, he did have it, and that is unfortunate. Here are our options for genetic testing for the parents: carrier testing, prenatal testing, and blood testing. So the Walter sisters, they should most likely use blood testing because it is sufficient to analyze the DNA and tell the patient if they are a carrier or if they are clean. After the test has been performed, it is recommended that they do go to a genetic counseling appointment, as a genetic counselor would help them. It would help them plan for a family, and if they were planning a family, they would totally need that because, as you know, one of the Walter sisters is 10 weeks pregnant, and if they are having a child and the child does have the mutated FMR1 gene, a genetic counselor would indeed help them lead a happy and healthy life with counseling on what to do to properly take care of the child and what the parent should expect in terms of growing up with their child. So some of the risks associated with Fragile X is autism spectrum disorder, seizures, hyperactivity, and ADD, and anxiety, all resulting from the malforming of the brain. However, there are treatment options for Fragile X, even though there is no cure. Speech and behavioral therapy are great options to help social functions of those who suffer from it, because it will help them how to control themselves and how to properly communicate, even though it will be difficult. And there are medications that they can take to calm them, because certain patients with the Fragile X can be violent, and resulting from that, antipsychotics are a great option to try and help calm them, and selective serotonin reuptake inhibitors may help calm them as well. Managing Fragile X, the families can always contact the National Fragile X Foundation at the phone number given, or emailing them at the given address. And also connecting with the community support network for Fragile X can not only just help them with information, but people who have similar situations to them can really just share with them personal experiences and probably what they're going to have to expect if their child does have the mutated FMR1. So reproductive options, because people, even though they may be carriers, they may still choose to want to have children. One of their options is to just conceive naturally and have the child without any testing. Their second option is to undergo vitro fertilization, and from there, what will happen is a male sperm and a female's egg will be taken. They will be put in together and let to grow into a blastocyst. Then at around 8, once it has replicated enough times to make 8 blastocyst cells, one of them will be taken. The DNA will be put through PCR, then analyzed, and then the family will be informed if the blastocyst is a carrier of FMR1 or shows the gene, and if they do, from there it'll be the family's decision what to do with the blastocyst. And option 3 is to conceive naturally and testing the pregnancy via prenatal diagnostic tests. Their fourth option is obviously to simply adopt. So the takeaways from Fragile X is that Fragile X is more severe in men, and it often leads to infertility in them too, which is why it not only can males not pass it to their sons, but it's also unlikely they will pass it to their daughters too, because they can only pass it with their Y chromosome and not their X. And also, one of Mrs. Walter's other 3 sisters is also likely a carrier, because it is Fragile X is a 50% transmission chance from mother to daughter, and since Mrs. Walters is already identified as a carrier, it's likely that one of her other sisters is a carrier, and it would be a wise decision for them to all to be tested, because one of them is 10 weeks pregnant. There are some ethical and moral issues with the genetic testing, and there are many options, like genetic testing and therapies to all aid the offspring if the family chooses to conceive their newborn naturally without any sort of testing.